Hi guys, it's Khalid Sharif again, consultant orthopedic surgeon at the Spire St Anthony's Hospital and Ashton Hospital in South London. And today we're going to do a video about shoulder exercises. This is actually requested by my patients. The private practice is thriving, but they can't get access to face-to-face physio, so they've asked me if I could do something they can do at home. So let's start. The first exercise I'm going to teach you is with a chair. Simple chair. Basically, hold on to the back of the chair and you step backwards, taking more of your weight on your shoulder. And the stronger your shoulder becomes, the more you can step back and take more weight on the what's called the inferior cuff. Right. The next exercise I'm going to teach you is you can have a little weight. I've got a jar here, but you can have a weight or a can, and you're going to do side-to-side exercises. The next one is forwards and backwards. The next one is pendular rotation exercises. The next exercise we're going to do is walking up the wall. And you do this with your fingers and you step backwards. When you start off, when your muscles are not so strong, you find you are literally walking up the wall with your fingers. As your shoulder muscles get stronger, then you step backwards and you're literally just touching the wall, but gauging how far you can go every day as your shoulder range of movement and power increases. The next exercise I want to concentrate on is rotator cuff exercises. And for this, we use thorough bands or resistant bands. And they come in 4 strengths. We start off with the yellow, and then they go up to green, blue, and the hardest is the black. So I have we're going to use our colleagues Joe and Mildred here to demonstrate some of these exercises. So the first exercise is we're going to stand up on the TheraBand or resistance band and pull it upwards. And you can get these from Boots, by the way. And as you start off, you should start off with the weakest, the yellow, and then progress onto the green and then the blue. So don't start off with the hardest one, depending obviously on the strength of your shoulder. So the next exercise is we're going to stand on it and pull it upwards, like that. That works on the supraspinatus muscle. The third one is we're going to put paper underneath our arm. We tie the TheraBand onto a fixed object. I'm using Joe's spine. Never mind, Joe. And we pull out. So this is working at the infraspinatus muscle. And the other one is pulling the other way. And this works against the subscapularis muscle. Now, let me explain what the rotator cuff is. These are made up of 4 muscles, and it's the heart of the shoulder. There's the supraspinatus, which comes here. This is responsible for this movement upwards. The infraspinatus, which comes from the back here and attaches here to the greater tuberosity. The teres minor is just below it. And the subscapularis is actually from the inside of the shoulder blade and attaches to the lesser tuberosity here. So the 4 muscles are very vital to the function of the shoulder because they work against the pull of the deltoid. The deltoid is the big muscle here you see on the hood of the shoulder, and that tends to pull the head of the humerus upwards. Whereas the rotator cuff is working against it to try and balance and pull the humerus down. Now you can understand from this simple model here that if the rotator cuff becomes dysfunctional, the deltoid pulls the shoulder up and you get impingement. You get a squeeze of and a fraying of the tendon of the rotator cuff. It becomes inflamed, then partially torn, and then full tear, and then you get arthritis of the shoulder. So we're going to try and improve the function of the rotator cuff so that it balances the function of the shoulder and it balances the head of the shoulder in its socket, and you start to lose the pain of impingement and rotator cuff inflammation. Right. So there is controversy on whether you should use isotonic or isometric exercises. And let me explain in simple terms what this means. Isotonic exercises are these simple exercises where you are doing them against resistance. Let's stabilize Joe. Okay, so you're moving the joint and there is resistance. Isometric exercises is where you pull and you maintain the pull. So that is isometric. Now, there's no difference really when you look at the research and the literature. Some say isotonic is better than isometric. In my experience, you should start off with isotonic and then progress to isometric. The reason being is if you start off with the isometric exercises, the muscle may fatigue early. So if you start off with the isotonic, which is these are the isotonic exercises. Okay, and then progress to the isometric, where you are pulling against resistance but not moving the joint. Okay, the other exercise I want to concentrate on is exercises for frozen shoulder, and I have a separate video on frozen shoulder, and you can watch that on YouTube. But basically 3 simple exercises, again trying to improve the range of movement, gently stretching your range of movement but not causing any pain. So the first one is, if we say that the right shoulder is the affected one, and we just basically push it outwards. Push, just gently, not causing pain, just stretching. That's one exercise. The second exercise is to pull your arm backwards like that and try and reach behind your back. And you can gauge by how far it goes by how far your thumb reaches behind your back. The third exercise we're going to use, Mildred here, is you lie in bed and you lift your arm up and you hang it and you just use the weight of gravity to stretch it. As you get to the end of the range of movement, you can bring your other arm and just push it gently backwards. Now I must stress, especially with frozen shoulder, you should not be wrenching your shoulder, you should not be causing you pain. The same thing with rotator cuff disease and impingement. These exercises should not be causing you pain. They should aim to improve your range of movement and your strength of the shoulder. But if you're causing pain, you should step backwards and reduce the exercises. You should do these exercises about 3 times a day, each exercise about 5 reps, and hopefully things you will find improve with time, but they're very important, and I hope this video helps. Until we meet in the next video. Thank you very much.